Hi friends, welcome to the channel mlisanews. I hope you will be fine. This time we talk about what to do after popping a pimple, tips, cons and prevention steps. Could not resist the urge to secure that's it. Follow these skincare tips when you are confused about what to do after popping a pimple and how to prevent it. Most of us have committed certain skincare faults past at some same point in our lives. This includes forgetting to apply sunscreen when it's due, sleeping with makeup on, touching the face too often, and in the case of people with acne-prone skin, popping those pesky zits. People relating to the last category often find themselves anxious about what to do after popping a pimple. Yet, as time passes by and they learn to overlook the acne scar on their face, they move on to popping the next one. This article covers everything about steps to take after your smush your blemishes, why it is advised not to do so, how to prevent doing so, and how can one treat acne effectively. Read a way to get the solution of your problems. What to do when a pop pimple starts to bleed. Once you have popped a pimple and it has started to ooze out and perhaps even some blood, the first thing on the agenda should be to stop the discharge. Wash your hands thoroughly with soap, followed by soaking up the secretion with a clean cube. Tip for cotton pad. After the infected pimple becomes dry, wash your face with a gentle facial cleanser under running water, ensuring your skin is left perfectly clean. Pat your face dry with a soft and clean towel and resist the earth to touch the affected area. Soothe the skin area with an ice cube. You can also follow this up by applying some hydro hydrozone to the wound. Is an FDA-approved topical used to soothe skin inflammation and accelerate wound healing. If you're applying this antiment, ensure you allow it a few minutes to work before moving on the next step. Dress the pop pimple with a hydrocolloid pimple patch to protect it from coming in contact with germs. Many patches these days are infused with slightly acid benzoyl peroxide and soothing ingredients such as centella, tea tree oil, and witch hazel to heal and zit and help the skin recover faster while you can safely leave a patch off on for a few days. Ensure that you at least wait for 6 to 8 hours before peeling it off for best results. Popping a pimple, especially if you do it out of impulse with your fingers and without the supervision of a can cause permanent lesions in your skin. As odd as it sounds, this greatly depends on the type of pimples you have and well how exactly you secused it. Secusing a small puzzle with superficial suppuration may not cause much harm. However, popping deep pimples such as acne are likely to cause severe long-term damage to the skin tissue, which may lead to permanent scarring. In other cases, this may lead to permanent a surge of blackheads and whiteheads, painful lesions, inflammation, and even skin infections. Most skincare advice out there warns people against popping zits. However, many of us may point out that to seduce the gunk out of the pimples during in office. So is popping pimples really so bad? Well, there's a difference when does it in contrast to us picking on our zits using our bars fingers. Use a tool called a countdown extractor through which they carefully discharge the collected debris in the zit and then treat the skin area with an antibacterial solution. While the tools they use are sterile and disinfected, they do this with great precision and care, ensuring that minimal skin tissues are damaged in the process. Contrary to that, when we try to pop our own pimples, it is often an act of impulse and there is often little or hygiene involved, resulting in long term skin problems. Often now, which pimples to pop and which ones to cure differently, which prevents any fusion to the skin. Moreover, they may inject into the pimple before drying into it to enhance the healing process. To prevent popping pimples, it is important to understand the urge behind it. The reason why most of us can't resist popping one is that a pimple is a skin problem that just won't go away on its own. It needs to be treated. Hence, through the persisting and tingling sensation, patiently waiting for the pimple to go away seems utterly fruitless. We can't help wanting to do something about it. Hence, the best way to prevent popping pimples is to treat it. Use a reliable drugstore spot treatment product on the zit. To treat it, such products usually work slowly, so be patient and keep replying reapplying the gel ointment to at least twice a day. Leaving the product on would likely reduce your urge to secure visit. Another excellent way to prevent popping pimples is to, as mentioned above, dress them with hydrocolloid patches. The following are some permanent solutions to treat acne, especially after you have popped them. How to treat pimples instead of popping them? While it is obviously a bad idea to pop a pimple where we were all human and sometimes our persisting it can leave us no choice. After all, it can feel excruciating to just let it be and not do anything to fix the issue. However, instead of popping the zit, we recommend applying the following to the problem area instead. Over the counter spot treatments, the soothe and reduce the impact of stub-on zits using is the first step one should take. Ensure that the product you are using compresses active ingredients such as salicylic acid, benzoyl peroxide, or acid, as these have notable anti-acne properties. If gentle does not show results, you can use benzoyl peroxide product to dry out to oozing it. If you are certain that your pimple has formed as a result of excess some or clogged pores, then you can also topically use sulfur as a spot treatment. Sulfur is an antibiotical ingredient that helps treat pimples by drying out the pus. It is considered an effective acne treatment for those with sensitive skin. Topical retinoids. OTC treatments work well for people whose skin type is less acne prone than others. However, if your skin type is on the oilier side, is more prone to breakouts, and is not too sensitive to pres- prescription strength treatments, then topical can work wonders for your skin. Some effective FDA approved retinoids for treating acne include adoplan, triton, etc. These antiements, however, are prescription based and can only be used when recommended by a. Besides, these topical treatments are quite strong, cause a slight tingling sensation in the skin, and may not be tolerated very well by people with sensitive skin types. Adopelin is proven to be more well tolerated by the skin than tritonian. However, it is also slightly less effective than the latter. For acne treatment, often recommend using the two in combination. Topical antibiotics. Skin specialists often prescribe topical antibiotics in addition to or without retinoids. These include antiemets comprising atheromycin, topical or depson, proven for their anti-acne properties. Alongside topical treatments, may also prescribe oral antibiotics such as doxycycline and lactic acid vacuoles. Anti-inflammatory treatments. In addition to the antiemets and spot treatment products, you are administering on your pimples using skin soothers such such as aloe vera or centella acetica gel can help reduce inflammation and restore overall skin health. Moreover, when using acne products, it is also important to use a gentle moisturizer from time to time, if not every day, to quench the skin. Acne prone skin should only be exposed to non comedogenic moisturizers so they don't cause more blind pimples. Popping pimples result in a loss of skin tissue that leads to deep in the skin nodes as acne scars, while popping shallow pustules leaves behind smaller scars, doing so to deep entrenched creases and nodules can cause deeper, longer lasting scars. Hence, how long an acne scar lasts highly depends on its depth. When should one consult a dermatologist? It is critical to see when over the counter acne treatment products don't show results in improving the pimple. If you popped and drained a pimple at home, you should definitely see a skin specialist to help treat the acne scars and hyperpigmentation left behind. Most individuals with acne prone skin have taken matters into their own hands at some point in life, followed by wondering what to do after popping a pimple. While the above mentioned steps and skincare tips are vital to follow, what's more important is that we quit the habit of picking our zits permanently before it causes permanent damage to the skin. Moreover, it is circle to fight pimples at their information stage using topical treatments like Adopel instead of addressing the issue superficially. I hope you will enjoy this news. Have a nice time. Goodbye.